Hello, I'm Ashley Pitts, and we're going to do the head to toe assessment. Here is my room. I have some tools over here. I have a pen light, stethoscope, reflex hammer, some odors to check cranial nerves, time depressor, and some hand sanitizer and alcohol wipes to clean. But I've already sanitized all my equipment, and I've sanitized my hands, provided hand hygiene. Please verify your name and date of birth. And please tell me, check your armband, and please tell me where you are today. Tell me what month it is. Tell me who the president is. Perfect. So he's ANO times 4 because he's oriented to person, place, time, and situation, and he's awake, and he's has clear responses. They're coherent. He's able to hear me, so hearing is intact. We've tested the vision with the Snellen test. He's 20/20 on both eyes, uncorrected, so optic nerve is intact. And blood pressure is 120/80 millimeters of mercury. Temperature is 98.6 degrees Fahrenheit temporally. Apical pulse is 70 beats per minute, and respiratory rate is 20 breaths per minute, even in non-labored. And so far, looking at him, his skin, he looks symmetrical. Arms, legs, chest, eyes, nose, ears are all symmetrical. No skin breakdown, no edema noted or swelling on the upper extremities. I don't see any goiter or swelling around the neck. I don't see any drainage or redness in the eyes or ears, nose. And he's well groomed. He's wearing clean clothing, hair looks neatly combed, and no skin breakdown. I don't see any. And so I want you to do some range of motion. Go like this, circumduction, and then flex and extend. Put your arms behind, and then as far as you can, like this. And would check rapid alternating movements. Turn head this way, and then against resistance. And then check trapezius by ear to shoulder, as well as shrugging the shoulders, and then put resistance there, and then shrug the shoulders against resistance, and cranial nerve 11 is intact. And then also sanitize my, sanitize my hands, and we'll also check for muscle strength. I would have my patient grip my hands as hard as possible, and then push and pull against resistance. And that's equal and strong, full range of motion, grade 5 range of motion. And now I'm going to sanitize my hands, palpate around the sinuses for any pain, look at the head and palpate the head for any lesions, indentations, look for any lice, and there's none. Palpate the tragus, palpate the outer ear, palpate TMJ. Please open and close your jaw, and then close your jaw, move your jaw side to side, and I'm palpating the temporal and the masseter joint, and I don't feel any tenderness, inflammation, no grating. He's able to move his jaw freely, and his skin is warm. And I'm also palpating lymph nodes, pre-auricular, post-auricular, occipital, submaxillary, submental, anterior cervical chain, posterior cervical chain, and by the clavicle, and no tenderness noted, no pain noted. Also, we're checking the carotid pulses, carotid arteries, and then check the brachial, and then check the radial, and they're all strong and equal. They're a +2. And also we'll check the posterior tibialis and the dorsalis pedis, and they're strong and equal bilaterally in the lower extremities. So sanitize my hands, and also we're going to palpate the thyroid. So please swallow, and then please swallow, and it's non-palpable. Also, my patient doesn't have any allergies to medications, none to food, none to the environment. Do you wake up happy every day? And any issues with using the restroom? Like, do you have any burning or pain upon urination? What color is your stool? How many times you have a bowel movement in a day? What is the color, consistency? And for urine, how many times you urinate in a day? Any burning or pain upon urination? And what's the color of any foul odor? Okay, perfect. And then, so now let's check for cap refill. I've pulled down for 5 seconds, press down on the bed, finger bed nails and nail beds, and it's less than 3 seconds. And on the lower extremities, I'm pressed down, it's less than 3 seconds. And just to, that's a demonstration. And so now we'll go ahead and test. Close your eyes and close one of your nostrils. Tell me what you smell. Perfect. He got it right. And close your eyes still. Close your other nostril and tell me what you smell. And he was right. Perfect. He told me what he smelled. And now we're going to test cranial nerves 3, 4, and 6. Please follow my pen light. Only follow it with your eyes. Don't move your head. We're testing for cranial nerves 3, 4, and 6. Starting with 6 cardinal fields of gaze. And I don't observe any nystagmus. Let's check for accommodation. So please follow the pen light towards your nose slowly. And I see accommodation in the pupils. And now let's check for the constriction of the pupil. So please look straight at me. I'm going to shine the light in your pupil. And in the illuminated one, it's constricting. And in the unilluminated one, it's constricting as well. Now I'm going to illuminate the other one. And this one's constricting as well as the other one now. So consensual and direct response is intact. And pupils are equally round and reactive to light. And now that I have the light on, let's check for JVD at a 45-degree angle. And JVD at a 45-degree angle on both sides, and no JVD. And looking in the ears, I see minimal cerumen, no drainage, no redness or inflammation. And on this side as well, I don't see any redness, inflammation, no drainage, minimal cerumen. Inside the nose, there's no blockages, no skin breakdown. Open your mouth, please. Stick out your tongue. Stick it to the left and the right. And like this. Against, and I would go like this. And so cranial nerves 9, 10, and 12 are intact. So I'm going to check for gag reflex. And gag reflex is intact. The uvula is midline. And please lift your tongue up. And frenulum is midline. I don't see any sores in the mouth. No cavities. The mucous membranes are pink and moist. And he's able to swallow. Please drink this. He's able to swallow. Perfect. And now let's check for facial nerves. Please raise your eyebrows, puff out your cheeks, smile, frown, and show your teeth. And we've probably TMJ, facial nerves are intact. And now we're going to test for the whisper test for cranial nerves 8. Please cover one of your ears, and I'm going to whisper something. I'm going to be 1 to 2 feet behind you, and please repeat back to what I say. Bob Marley, and he's correct. Cover your other ear, and please listen to what I'm going to whisper something. Repeat back what I say. Disneyland, he's correct. So hearing is intact. And now please stand feet together, hands at the side, and I'm observing the patient for 20 seconds while his eyes are open. And then after, close your eyes, observe for 30 seconds, observe for any swing, and I don't see any. Now I'll have him walk for 5 steps to observe for gait, and then walk heel to toe. And balance is intact because patient is able to walk with ease. And now we're going to check for reflexes. So I have the reflex hammer with the pointed end. Let's check the bicep, tricep, and relax this whole time. Now flat end for the brachioradialis. And I see grade 2 reflexes. Now with the pointed end, this side, this is biceps, triceps. Flat end we'll use for the brachioradialis. And then for patellar, any history of knee surgery or injury. And then we'll palpate right here. And grade 2 reflexes. The muscle contracts. And Check for trigger, skin triggers tight, no tenting. With the bell of the stethoscope, let's listen for bruit and the carotid. So take a deep breath, hold your breath. Take a deep breath, hold your breath. And I don't hear any bruit. Turn it over to the diaphragm to check for heart sounds. So right sternal border, second intercostal is the aortic, and S2 is louder. Left sternal border, S2, second intercostal, this is pulmonic, and S2 is louder. Third intercostal, Erb's point, S2 is equal to S1. Third intercostal, tricuspid, I'm sorry, fourth intercostal, tricuspid, and S1 is louder. And then fifth intercostal, mitral, is mid clavicular, and it's point of maximum impulse. So I'll move forward, and I'm going to palpate the carotid at the same time, and listen for a minute, and it's 70 beats per minute, and it's synchronous. And now we'll listen for lung sounds. Take a deep breath every time I move my stethoscope. I'm listening anteriorly and for lateral, and avoiding bony prominences. And lift your arm up for the right lobe, right mid-axillary, fourth and sixth intercostal space for the lateral. And then turn around, take a deep breath every time I move my stethoscope. We're looking posteriorly. And it's all clear. Respirations are even and unlabored. No wheezing heard. It's all clear in all lobes. And now have you lie down. We're gonna listen. We're gonna inspect at eye level for any. I don't see any pulsations. The stomach is round, and no distension, no bruising seen. We're gonna auscultate with the diaphragm. Starting the right lower quadrant, I'm gonna divide it in 4 using the umbilicus. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. I hear 5 to 30 gurgles and clicks in each quadrant. Listening for 15 seconds. And now I'm gonna auscultate for bruit using the bell, and starting at the xiphoid process, aortic arteries, and then bilaterally, just an inch away, are the renal arteries. Locate the umbilicus, and bilaterally are the iliac, and then locate the pubic bone, and bilaterally are the femoral. And I don't hear any bruit. And now we're going to do some percussion for the abdomen. We're starting in the right lower quadrant, and it's tympani. And now we're going to do light palpation. Starting right lower quadrant, going clockwise, and no, it's non-tender, no pain, and there's no distension. It's soft. And now looking at the lower extremities, I'm palpating for edema, and no edema over bony prominences, and no varicosities, no edema, no skin breakdown on the bottom of the feet. I would check for muscle strength by having the patient push down against my hands and then push up against resistance and point their toes up to the ceiling and then down, and then check for range of motion, flex and extend, and check for heel to shin. Slowly raise your shin up to your knee, and I would have them do that a couple of times, and they're able to do that with ease. I would have them do that supine, and full range of motion in lower extremities. It's grade 5, and as well as in upper extremities. And no facial drooping, no patients able to have range of motion in all extremities. And cup refill. We check for cup refill in the lower extremities, and it's less than 3 seconds. And he is symmetrical in regards to his limbs and chest. Thank you.